أتبين؟
ايه دكتور.
فبروتوزول نكود chemotherapy against MBSs أو malaria leishmaniasis toxoplasmosis and giardiasis. بالنسبة للMBSs in term of infection بالبداية هو ingestion of the cyst. While ingesting the cyst it's hashed and cause formation of trophozoites. حال trophozoites can penetrated the intestinal wall and lead to multiplication of trophozoites within the colon wall. And after that, it can cause systemic invasion, include most of the common actually is the liver, and or formation the cyst again and expel trophozoite non-effective or expel the cyst which is ineffective. بالنسبة للتريتمنت نحن عندنا أكثر من طريقة للتريتمنت، يا إما يكون اللومينال أميبيسايدز مثل البارمومايسين أو الإيدوكوينول، أو ممكن التريتمنت بالنسبة للتشيو أو سيستميك أميبيسايد اللي هي كلوروكوين and dihydroemetin. أكو بعض الميديكيشنز have like dual mode، يعني يشتغل as mixed أمبيسايد luminal and systemic مثل الميترونيدازول أو التينيدازول. هاي خلينا نقول the summary of the whole thing. الانفكشن عادة يكون من Antimibia histolytica. Therapy is indicated for both systemic and symptomatic and asymptomatic patient because the asymptomatic patient can cause spreading of the infection. Therapeutic agent مثل ما قلنا dividing luminal and systemic or mixed MBB depend on the site of its action. بالنسبة للميكس أميبيسايد مثل ما قلنا ميترونيدازول اللي هو عبارة عن نيتروإميدازول is the mixed amibicide of choice for treatment of amoebic infection. The mechanism of action, the amoebas possess redoxin-like low redox potential electron transport protein that participate in the metabolic electron removal reaction. The entire group of metronidazole is able to serve as electron acceptor, forming redoxed cytox compound binding to the DNA and the protein, resulting in the death of Amoeba histolytica trophozoite. طيب أنت إيش مطلوب منك تحفظ؟ حقيقة ما أطالبك بميكانيزم اوف اكشن بالنسبة للميترونيدازول against Amoeba histolytica. ممكن تعرف إنه selectivity against Amoeba histolytica because of the presence of الفريدوكس like electron transport protein، لأنه موجود دي هذا البروتين موجود فقط بالأميبا، فهون في عندنا selectivity against this parasite and that's all. بهذا تحوله إلى toxic compound ويدينا إلى killing of the Amoeba histolytica trophozoites. حقيقة الميترونيدازول as indication هو ما فقط اللي anti parasite، have many antibacterial antiparasitic effect. على سبيل المثال راح ناخذ بالسلايدات القادمة إن شاء الله infections caused by Giardia limberia وترايكوموناس vaginalis واللي sexually transmitted disease. حقيقة هو drug of choice against anaerobic cocci and anaerobic gram-positive bacilli مثل bacteriod species. إضافة لكل هذا إذا تتذكرون نحن كان حكينا عن metronidazole as a drug of choice or as a treatment for pseudomembranous colitis that caused by anaerobic gram-positive bacillus colidium difficile. وكان قلنا ال best treatment هو restoring the microbiota. بعد ممكن ال vancomycin is better than metronidazole against such infection, but still metronidazole can be used for pseudomembranous colitis. من ناحية pharmacokinetic parameter, it's completely rapidly absorbed by oral administration. Metronidazole distributes well through the body tissue and fluid. Therapeutic level can be found in the vagina, seminal fluids, saliva, breast milk, and cerebrospinal fluids. فحقيقة يلا من أهم السايد افكت مالته اللي هي nausea, vomiting, epigastric distress, and abdominal cramp. حقيقة المترونيدازول causing metallic taste inside the mouth. دائما نشوف اللي ياخذ المترونيدازول يحس إنه حلقه دائما ممامه. أكو unpleasant metallic taste اللي هو عادة common experience. فخلي بالك إنه بسبب إنه كثير من the practitioners prescribe metronidazole without a proper diagnosis حقيقة. They can proper diagnosis for diarrhea can complicate the situation of patient with diarrhea. ليش؟ لأنه خصوصا يمكن أطباء الأطفال الطفل يصير عنده diarrhea يعطيني metronidazole وهو عاد 60% of this kind of diarrhea is viral infection. The other 40% is metronidazole. Most of them they not effective against them. But لما تعطي metronidazole وتعطي يصير GIT distress وميتاليك تيست وحتى خلينا نقول الابيتايت مع هذول الكيدز راح تضعف كلش كثير فما حياخذ فلويد فممكن يزيد عنده الديهيدريشن. وإضافة إلى ذلك it can cause diarrhea by itself. So other include oral menuliasis like yeast infection over the mouth and really neurotoxicity. It has neurotoxicity, the symptoms are dizziness, vertigo, numbness, or paresthesia, which by necessitate discontinuation of the drug. من ميزات المترونidazole can cause a kind of reaction called disulfiram-like reaction, which is once you ingested with alcohol, it can cause very annoying hot flushes. Metronidazole هو يعتبر second generation من بالنسبة للنيتروميدازول that is similar to metronidazole in spectrum of activity, absorption, and adverse effect and drug interaction. It's used to treatment of amoebiasis, amoebic liver abscess, giardiasis, and trichomoniasis. Tinidazole is effective as metronidazole with a shorter course of treatment. ليش؟ لأنه have very long half-life, it is more expensive, and alcohol consumption should be avoided during therapy because the disulfiram reaction. It's just like metronidazole. من ناحية luminal amoebicide, after the treatment of invasive intestinal or extra-intestinal amoebic disease is complete, luminal agent like idiquinol or diloxinide furet or Pharmacomycin should be administered to treatment of asymptomatic colonization state. Idiquinol عبارة عن halogenated hydroxyquinolone, which is considered as amoebicide against Amoeba histolytica and is effective against luminal trophozoites and cyst form. It has adverse effect, can cause rash, diarrhea, dose-related peripheral neuropathy, like optic neuritis. Long-term use of this drug should be avoided. Hormone Myosin is aminoglycoside antibiotic, is only effective against intestinal luminal form of Amoeba histolytica because it is not significantly absorbed from the gastrointestinal tract. Pharmacomycin is directly amoebicidal and also exert its anti-amoebic action by reducing the population of intestinal flora. مثل ما قلنا هو لأنه aminoglycosides have antibacterial activity. It is also alternative agent for cryptosporidiasis angioradiasis. The gastrointestinal distress diarrhea is the major adverse effect. These drugs are بالنسبة للسيستميك amebicides is useful to treat liver abscess and intestinal wall infection caused by amebas. The chloroquine, which is used in combination with metronidazole or as substitute for one of the nitronidazole in the case of intolerance to treat amoebic liver abscess. It eliminates trophozoite in the liver abscess, and it is not useful in treatment of luminal amoebiasis. Therapy should be followed with the luminal amoebicides. Dihydroemetine have many side effects. It is an alternative agent for treatment of amoebiasis. The drug inhibits protein synthesis by blocking chain elongation, and intramuscular injection is a preferred route since it is irritant when it's taken orally. Adverse effects include pain at the site of injection, nausea, cardiotoxicity, and even can cause digestive heart failure, neuromuscular weakness, dizziness, rash is also common in the treatment of dihydroemetine. Common with treatment with dihydroemetine. بعد الامبيبيسايتس السيستميك واللوكال or luminal راح نحكي عن الانتي ملاريا ميديكيشن. الانتي ملاريا medication which treat malaria, which is acute infectious disease caused by 4 species of a protozoal genus Plasmodium. It is transmitted to the human through the bite of female Anopheles mosquito. Plasmodium Falciparum is the most dangerous species, causing the acute, rapidly fulminating disease that is characterized. Plasmodium falciparum infection can lead to capillary obstruction and death without prompt treatment. The Plasmodium vivax causes milder form of the disease, while Plasmodium malaria is common to the many tropical agents. But the Plasmodium ovale is rarely encountered. Primaquine is the oral anti-malaria drug that eradicates the primary exoerythrocytic form of Plasmodium, وعادة يكون in tissue. The secondary exoerythrocytic form of recurring malarias is the only agent that prevents relapse of Plasmodium vivax or ovale malarias, and sexually gametocytic form of all 4 plasmidia are destroyed in the plasma and prevented from maturing later in the mosquito. The mechanism of action, metabolite of primaquine is believed to act as oxidant that cause stenoticidal action as for hemolysis and methemoglobinemia. It's well absorbed when administered orally. Side effect causing hemolytic anemia, especially in G6PD deficiency, patients with the G6PD deficiency. Large dose can cause abdominal discomfort. The chloroquine has been the mainstay of antimalarial therapy. It is the drug of choice in the treatment of erythrocytic falciparum malaria, except in the resistant strain, which is specific for a sexual form of Plasmodium. The chloroquine is used in the prophylaxis of malaria for travel to area with non-chloroquine sensitive malaria. Mechanism of action binding to hemine prevent its polymerization to hemazoin. بالمناسبة الملاريا ingested hemoglobin or heme. So chloroquine bind to the heme and prevented its polymerization to hemazoin. Why is the only way to excrete or to get rid of heme is the formation. And the parasite is formation or converted to the hemazoin. The increased pH and accumulation of heme result in oxidative damage to the phospholipid membrane, leading to the lysis of both the parasite and the red blood cell. At higher doses, side effect can cause gastrointestinal upset, pruritus, headache, and the blurred vision also may occur. Teraboquine, praguanil, this combination is effective against chloroquine resistance strain of Plasmodium Falciparum, and it is used in the prevention and treatment of malaria. Common side effects can cause nausea, vomiting, abdominal pain, headache, diarrhea, anorexia, and dizziness. Mefloquine is effective single agent for prophylaxis and treatment of infection caused by multi-drug resistant form of Plasmodium falciparum. In terms of adverse effects, it can cause, especially at high doses, range from nausea, vomiting, dizziness, disorientation, hallucination, depression. Because of the potential for neuropsychiatric reaction, mefloquine is usually reserved for treatment of malaria that other agents cannot be used. So it can cause CNS adverse effects, severe adverse effects. That's why it is reserved as final resort. لهون راح ننتهي المحاضرة اليوم. هنكملكم إن شاء الله يوم الخميس. بالنسبة للباراسايت نحكي عن الكيموثيرابي فور ليشمانياسيس وجيريدياسيس. أتوقع ليشمانياسيس بعدين توكسوبلازموسيس and جيريدياسيس. فإن شاء الله نشوفكم يوم الخميس بإذن الله حتى نكملكم. احنا بالنسبة للمحاضرات اللي بقت هنكمل الباراسايت. نبدي بالانتي فايرال. نخلص الانتي فايرال اتوقع ما راح يظل عندنا شيء يمكن. انتي فايرال بعدنا ان شاء الله الاسبوع الجاي